Hello and welcome to our capstone. My name is Jordyn Kruse.
And my name is Joey Walp.
Our capstone is titled Discharge Preparation for the Client Following Heart Failure Exacerbation. For our preceptorships, both of us were in progressive care units. I was at Tacoma General Hospital and Joey was at St. Peter's Hospital. Joey's PCU was a cardiac PCU, so obviously he saw a lot of cardiac patients. But with that came many heart failure patients. My PCU was more general. We kind of saw a little bit of everything. However, I actually ended up seeing a lot of heart failure patients as well. And this goes into our inspiration for this capstone. Heart failure is such a prominent condition in the healthcare and medical worlds, and we've really learned about it since our very first semester in nursing school. We've seen it time and time again in clinical, and we've both seen the toll that it can take on a patient, both physically and mentally. So through working with these patients, we've learned just how life-changing of a diagnosis this is for the person, since they're the ones that have to go home after being discharged and successfully manage their heart failure and everything that comes with it. So because of this, we really wanted to research just exactly what information is the most important for the nurse to get across to the patient when providing discharge education, and then some of the best ways for the nurse to do this in order to lower the risk for the patient having to come back to the hospital.
Yeah, and when reading through the literature on heart failure, there were a couple of points that reinforced our pre-existing knowledge of heart failure. The first is how high heart failure readmission rates continue to be. We found that the readmission rates for 60 to 90 days, a heart failure patient is 25 to 30% likely to be readmitted. The other information that reinforced our knowledge on heart failure was how important it is to monitor and teach self-care practices of monitoring weight, exercising, and restricting fluids. We found that when a patient really adheres to these guidelines, better outcomes are achieved. There was also some information that surprised us when reviewing the literature. In our research, we found that about 20% of patients meet the criteria to be diagnosed with depression due to the symptoms and the nature of the disease. It surprised us that depression is so prevalent in heart failure patients and opened our eyes to evaluating the mental health of this population. Another piece of information that surprised us was how effective follow-up telephone calls by nurses can be in reducing all-cause mortality and heart failure readmissions. A simple phone call to check in on a patient to ensure they are adhering to guidelines and they have all the resources that they need can decrease these parameters significantly. One systematic review that we read showed that doing this can decrease all-cause mortality by 12% and heart failure readmissions by 9%. One of our biggest takeaways from completing this capstone project was how important it is to assess self-care practices and getting to the core of why a patient is unable to manage their disease effectively. An effective way that we found in the literature is motivational interviewing. This technique includes asking the patient questions and exploring their thoughts and beliefs of their disease. By doing this, you can work cooperatively with a patient to come up with a plan to make them manage their disease successfully at home. This is a more effective technique than just telling a patient to do something such as restrict their fluids and then sending them home. Another big takeaway from this project is how important including friends and family or some kind of home support system is. For example, a patient who has a wife at home cooking for him is more likely to be successful and supported at home than a single person who is too tired to cook for themselves and buys processed foods and salty foods. This could lead to a heart failure exacerbation and get them back in the hospital. We found it to be so important to assess this so that you can provide home support and ensure best disease management for the patient. One last key takeaway we got from this project was the importance of not only teaching patients signs and symptoms and self-care practices, but by providing some sort of take-home packet. If a patient has a packet to refer to, they will feel more comfortable about managing their disease. On the top right of our poster, we have an example of a heart failure self-check plan worksheet from the American Heart Association. This will help the patient by letting them know when are appropriate times to call their doctor or 911 so they can effectively manage their disease.
So this capstone required a lot of rigorous research, and through this research we were really able to hone in on just how important it is for the nurse to provide comprehensive discharge education to a heart failure patient, since like we mentioned, it's a disease that really affects every aspect of their life once they go home, and it's therefore very important to make sure that they understand how to manage it. And because of this, we'll be able to take that knowledge into our future nursing practice and give much better care to our future patients.
Yeah, and we just want to say a couple special thanks. Thank you to our preceptors and the hospitals that allowed us to do our preceptorship. We also want to say thank you to Dana Zeichkin, who was our advisor and helped us out a ton throughout this project. And then also to the Paley School of Nursing for just continual support. And we want to say thank you for watching this video, and we hope you enjoyed it.
Yes, thank you.